Hello, everyone. Welcome back to the NeuroVerse podcast. Today, we have a recurring guest on. We have Mrs. H, and today she's going to give us a little insight into Alzheimer's. In a previous episode, we touched kind of on the scientific and the medical aspect of it, and now she's going to give us a little bit of a look into her life because her mother has dementia, and she's going to share a little bit about that. So, yeah, thank you for coming on.
Thank you for having me, Ellie. It's great to be back.
Awesome. Let's just jump right into it, I guess. So the first question I have is, so I know your mother has Alzheimer's dementia. So can you share a little bit about how she was before it and kind of the main changes that you've seen, post um, diagnosis?
Sure. Yeah, my mother, prior to having symptoms of dementia and Alzheimer's show up in her life, she was a very educated woman, back in the day in India when there wasn't too much education for women in the town that she came from. She did a lot of higher education, was a PhD in ironically in psychology,
Mm-hmm.
which deals with the brain, and she dealt with many patients in from a clinical diagnosis point of view that had brain-related issues, and she was very passionate about healing and teaching psychology to other students. She was even a professor of psychology. She was a very confident woman, very put together, and very on top of her game, social, and had a lot of friends. But the dementia um, really changed her.
Mm-hmm.
When the dementia came on, she started to become a little bit more of a recluse. She started to forget things, which would make her embarrassed in conversations. She would forget people's names. She would pretend she remembered them. But she obviously couldn't locate where she had seen them or what their name was. So these were just small clues that we were seeing when the dementia started to come on slowly.
Mm-hmm.
I can go in more depth if you'd like, but if there was something else you wanted to ask in the meantime, that's fine too. You just let me know.
Yeah, yeah, I guess, yeah, so I guess going a little bit more in depth, when did you first start noticing signs? What age, and can you also, share a little bit more on what you just said?
Yeah. She has a family history of dementia, so my mom's side of the family has a family history of dementia. Her older sister, had severe dementia and had passed from old age, but when she had passed, had severe dementia. She could not recognize anybody. So we already knew that, there was a chance that my mom would be having that. And so I was very tuned in and clued in when she started showing signs, which was probably in her, I would say mid 70s is
Mm-hmm.
when I first started noticing signs of dementia,
Okay.
maybe even early 70s, to be quite honest.
Oh, and
Um,
may I interrupt real
yeah,
quick? How
yeah.
old is she currently?
She's currently 85.
Okay, okay, sorry, yeah,
So for
continue.
15 years, yeah, no problem. So for 15 years, she's been a dementia patient. The first couple of years, it wasn't too bad. It was just kind of forgetting little things, asking the same question several times, but yet she was still able to travel. She was still able to kind of manage on her own. She would be able to take walks around the neighborhood on her own. She wasn't, that severely symptomatic of dementia.
Mm-hmm.
But that slowly became worse when my father passed away about 10 years ago. It kind of bloomed and the dementia just kind of progressed really fast after that. I think because she became alone, she did not have a partner, she did not have somebody to converse with. I think she became the dementia just kind of affected her and progressed really fast. And to the point where, she is now at that point where she cannot manage, she cannot live on her own, not because physically she is incapable. She is actually very physically healthy.
Mm-hmm.
She doesn't have any other physical medical issues. as far as her heart, her kidneys, her lungs, nothing, everything is working great. She doesn't have any blood pressure, diabetes, nothing like that.
Mm-hmm.
It's just her brain doesn't function. She doesn't remember anything. She doesn't recognize people. So yeah, it's a very difficult and lonely life for her.
Yeah. Yeah. So were there like any specific moments that felt especially overwhelming? You know, maybe a specific story or something that she couldn't do that she could do previously that made you feel a little bit overwhelmed.
Yeah, so one story that comes to mind, and dementia patients, and like we've talked about in a previous episode in which I was with you, is that any brain related disorder, there's a spectrum. So what you would see with my mom, you might not see with somebody else. But with her specifically, she had a moment, like a brief moment of almost like a anxiety attack in which her brain brought her back to when she was younger and she had younger kids.
Mm-hmm.
And she thought that she had lost one of her younger children. And so she kept telling me, she kept taking my brother's name, and she said, he's lost, and I need to find him. So it was very heartbreaking for me because I tried to explain to her to the best of my ability that, he's an adult and, you've raised him well and he's in his own house. I even had him call her and talk to her while she was in this episode of anxiety, but it just didn't register for her. And her answer was, I understand you are old and you are my son, but my younger son, my little one is lost.
Mm-hmm.
So, it just kind of goes to show you how the brain works, and, the brain plays games on you when you
Yeah.
have dementia. So, it's always playing tricks on her. And so that day was very difficult because she was in a state of stress and anxiety for almost the whole day, where she was very stressed out. And in fact, it's a little funny because she was getting upset with me
Mm-hmm.
and saying that I'm not doing anything to help her. And how could I be so heartless to
Yeah.
not help her? So, so I just try to give her love, and I just try to explained to her, but it wasn't going to go away until, finally I was able to get her to go to sleep. And when she went to sleep, when she woke up, then that episode was over.
Yeah.
So there's many such episodes that happen. Not necessarily that specific one where she thinks her child is lost,
Mm-hmm.
um, but other episodes in which some other story or some other hallucination would be going on in her mind, and it would give her stress and anxiety. So it's yeah, there's medications she takes to control those symptoms, and she sees a neurologist
Mm-hmm.
regularly that controls her medications. But it's not, medication is kind of a band-aid, I feel, once you have dementia. Your brain is playing tricks on you, and different medications can control one thing but might ignite a different issue. So it's a constant game of kind of analyzing her behavior, her mood, and taking her back to the doctor to see what we can do to help her best.
Yeah. Yeah. Thank you for sharing that. So moving on to the next question. It's kind of a similar thing, but more of like a day to day version. So what are like some of the biggest daily challenges that you face as a caregiver?
Those daily challenges as a caregiver have evolved over
Mm-hmm.
time. Previously, 5 years ago, the daily challenge might have been to give her company or to sit with her and have conversations with her, to keep her mind active, to play crossword puzzles with her or watch her favorite movie with her, to keep her engaged. And now, the daily struggles are much more different as her dementia has progressed.
Mm-hmm.
She can be dangerous to herself, in the sense that, she might want to walk out of the house. And once she leaves the house, there's absolutely no way for her to remember how to get back.
Yeah.
So to make sure that the doors are locked and to have special doorknobs put in the house so that she doesn't know how to open them to leave the house. There always needs to be somebody at home with her to watch her. So that's another struggle because if, we kind of all take turns in the house between myself and my family members, we always try to make sure that there is somebody at home and everybody is not out of the house at the same time.
Mm-hmm.
In the situation that we are all out of the house at the same time, we have to arrange for a house help, somebody that knows her issues that can, kind of be vigilant of making sure that she doesn't do anything dangerous, keeping the microwave locked because she gets the microwave confused with the washing machine. So
Mm-hmm.
sometimes she'll want to, dry something, a scarf or something, and the microwave is obviously not the right place to dry it.
Yeah, yeah.
So, situations like that are daily struggles. Just keeping her safe is my biggest challenge at this point, um, because otherwise she doesn't really, remember who I am or remember my other family members. So, the social aspect is there. We do want to keep her engaged in conversation as much as possible,
Mm-hmm.
but the safety aspect is a lot more important right now.
Yeah, yeah, that makes a lot of sense. So how do you balance um, caring for your mother with other responsibilities like family or work or other things, or like do you kind of always have the lingering thought in your head like, is she safe? What is she doing? Things like that.
That's a great question. And the answer to that is yes, I do always have that lingering thought in my head. Is she
Mm-hmm.
safe? Is she okay? There was a point that I had moved my work table upstairs,
Mm-hmm.
right outside her bedroom so that I could be available, like I could keep an eye on her while I was working.
Mm-hmm.
And that was a really great method for me to make sure that she was safe at all times. This was, I probably did that for several years. Um, and then, so that's one way. Um, and then just like I mentioned earlier, making sure that, somebody is keeping their eye on her in the house while, if I am not home, then if one of my kids are home, I make sure that their door is open so that they know what their grandma is doing, make sure that she's not, leaving. Also, another thing that we've done, we've installed cameras around the house,
Mm-hmm.
which are connected to our phone. So we can always kind of look at which part of the house she's at. We have a Ring doorbell installed that just in case she was to leave from the front door somehow, although we have methods that we've put in place where she would not be able to open that door, but in case somehow she's able to, we have a Ring doorbell that we'd be able to catch it right away. So from our capacity, we've tried every which way possible to do whatever we can to keep her safe. And it's a lot, I'm not going to say it's not, but I think we work together as a family and we make sure that, everybody's on board and they know how important it is to have these safeguards in place so that she stays safe with us.
Mm. So so you kind of say it's like, I know it's not the same thing, but in a sense, it's like kind of caring for like a young child.
Definitely. I think it's absolutely accurate to say that taking care of a dementia patient is similar to taking care of a child because there's a lot of similarities
Mm-hmm.
in the sense that, for example, a child would open the door and just run out and, you wouldn't even know because that's exciting to them or
Mm-hmm.
they don't know the harmful effects of being out there. And just like that, a dementia patient doesn't know that once they leave the house that they don't have the memory power to know how to come back to the house.
Mm-hmm.
Um, and there's scary stories I've heard, about people in my town, an old man who used to go for a walk every day. And, as his dementia got worse, he continued to go for a walk. But one day, as he was crossing the road, he got confused which way he had to go. And he was just standing in the middle of the road, and a car came and hit him because it was kind
Wow.
of dark out.
Yeah.
So things like that are very scary and they're very true. So, I could totally understand that, how that I could just almost picture that man being confused because I've seen that with my mom where she's in the middle of something and she's trying to figure it out and she just kind of stops dead in her tracks because she's so lost as to what to do next. So, yeah, it is similar to having a baby. Just like a baby doesn't understand many things and you're 24/7 have to take care of them, you can never leave them unattended.
Mm-hmm.
The same goes with a dementia patient.
Yeah, yeah, I bet. So what? How big of a role does like your community or like family, friends, or family play? Because I know you mentioned when you and you know the people in your house, your family are not at home, you have to have someone come and stay in your house or something like that. I think you mentioned.
Right, right. So, I think it's very important for anybody as a caretaker to have a good support system
Mm-hmm.
outside of, themselves, whether it's their extended family members or friends or connections that they've made in the community, because otherwise it can get very overwhelming
Yeah.
for a caretaker to be solely 100% responsible for taking care of a dementia patient. Um, so yeah, I have extended family outside of my husband and my children that are very that are very on board, and if I need them, they are there. Even my neighbors who live right across the street from me,
Yeah.
they're aware and they know, and there has been incidents in the past. One that happened just maybe a year ago where my mother-in-law, the front door was open because one of the kids had left it open. And she walked out and she went to my neighbor's house across the street and she was confused. She thought she was at one of her relatives' house and she knocked on the door and she asked for somebody that didn't live there. And my neighbor recognized her immediately and called me and brought her back home. So just making sure that people are aware of her needs, like on my street. That really helped because I couldn't even imagine if, my neighbor didn't know who she was or my neighbor
Mm-hmm.
didn't have that support system for my neighbor. That would have been very scary. And just like that, when we all go out of town as a family, I have identified caregivers that can come and stay with her and take care of her and make sure that she is safe, that she is taken care of, all her needs are taken care of, and be with her so that she could be safe until we arrive back into town. It's very important. I can't imagine a life without having this support system. It would be very hard to manage. A dementia patient without the support system. So, to all those families out there with aging parents, that, I urge you to start making those connections now,
Mm-hmm.
because, if your parent is a dementia patient, it only will get progressively worse, and you will need to have a support system in order to be able to take care of them. And as a caregiver, it's important that you have that to stay healthy yourself.
Yeah. Yeah, for sure. And wrapping it up, what is there? What advice would you give to someone who might be starting to go through, kind of the same thing that you've been going through for the past, however many years?
Right. So, I think I just touched upon it very briefly already right now, where I said, start making those connections with extended family and, support systems to kind of have a support system ready for when you need it. And then, other than that, the time that we have with our aging parents is limited. If you do know that your mom or dad is early stages of dementia, then get them their treatment early because, like I said, the dementia in my mom we started noticing it close to 15 years ago, and we got her help as soon as we noticed it.
Mm-hmm.
So she's been on medication for a long time, which has extended, her time, which has extended, I think, the, quality of her life as well, because if we had not started that medication, she might have been the position she's in now at 85. She might have been at that, much earlier. So, identify good doctors that can diagnose her, that can start the medication on her, and know that every 6 months you'll see changes in them. and you'll have to change your schedule accordingly. You'll have to change medications for her or him accordingly. And I think most importantly, I think it's important for me to tell those people that are going through the initial phases that hold on to good memories and conversations, engage them in conversation as much as you can now, because once the dementia gets very severe,
Mm-hmm.
they're not able to remember you, they're not able to have normal conversations with you, so they almost become like a stranger to you,
Yeah.
and that's very difficult. Going through that, seeing your parent become somebody who is absolutely different from what you remember them to be.
Mm-hmm.
So hold on to those when they're still able to have conversations, hold on to those and cherish them. And just make the most of them, make the most of their, memory while they have it. And then that's really it. It's tough and it's a struggle, but it's not something that we can't do.
Mm-hmm.
Just like we take care of our children until they become capable, and we have resources and help to do that. Just like that with our aging parents, dementia is really something that's become very common. I know many families with it, and through the resources we have and the guides that the doctors give us, we know the challenges that are coming our way.
Mm-hmm.
So we can just be aware of them and formulate a plan accordingly.
Awesome. Thank you so much for coming on and once again sharing such great insights. So we can all be informed. But yeah, thank you so much.
I appreciate that. Thank you, Ali, for doing this. I'm really happy to be here.
Awesome. And thank you everyone for watching.